Cancer develops when some normal cells become harmful and start to reproduce uncontrollably. Our immune system recognizes harmful pathogens and destroys them with different types of defense cells. However, the cancer cells know how to pretend to be normal. When the immune system doesn't recognize and destroy the cancer cells, they can reproduce undisturbed and cause the disease. Cancer drugs have been developed to help the immune system to better recognize and destroy cancer cells. These drugs are called immune checkpoint inhibitors. In this video, we tell you the basics about how they work and what kind of adverse reactions they may cause. Their medically induced changes in the immune system may cause quite challenging adverse reactions, which are different from those caused by traditional cancer treatments. At the moment, 2 types of checkpoint inhibitors have been approved for the treatment of cancer. Their activity is based on the immune defense cells called T cells and the proteins PD-1 and CTLA-4 on the T cell membrane. These proteins are receptor proteins, receiving a signal from the outside of the cell via their counterparts called ligands. The function of CTLA-4 is to restrain an immune attack. When CTLA-4 binds to its ligand, the T cells get a signal to settle and calm down the immune attack. Antibodies against CTLA-4 have been developed for cancer treatment. These drugs inhibit the signal transmission and strengthen the patient's immune attack on the cancer cells. However, at the same time, the inflamed immune system may attack some healthy cells, causing unwanted adverse reactions. On the membranes of the activated T cells, PD-1 proteins help the immune cells to recognize the cancerous and harmful cells. The ligand of PD-1 is called PDL, which appears on the membranes of several normal cells. When PD-1 and PDL bind to each other, T cells get the signal that the cell is not harmful and must not be destroyed. Cancer cells use this mechanism and produce PDL to falsely reassure the T cells. This is how cancer cells pretend to be normal and escape immune attack. Antibodies against PD-1 and PDL have been developed for cancer treatment. These drugs inhibit the interaction between PD-1 and PDL and expose the cancer cells to the T cells as harmful cells to be destroyed. However, sometimes T cells recognize some cells falsely and attack healthy cells. These adverse events are noticed as autoimmune reactions. Immune checkpoint inhibitors are promising drugs for cancer that have been difficult to treat. In the best case, these drugs provide good and sustained control of the disease, but they are not effective on all cancers. At first, the checkpoint inhibitors were studied on melanoma, and their use for other cancers will be expanded as the research goes on. Not all patients respond to these treatments, and the effectiveness of the drugs cannot yet be accurately predicted on each patient. Among the approved immune checkpoint inhibitors, nivolumab and pembrolizumab are antibodies against PD-1, and ipilimumab is against CTLA-4. Atezolizumab, avelumab, and durvalumab are antibodies against PDL. The CTLA-4 and PD route antibodies may be used concurrently or together with other cancer drugs. The adverse events caused by immune checkpoint inhibitors are completely different from those caused by traditional cancer drugs. The medically induced activation of the immune system often causes autoimmune reactions where the immune defense attacks the patient's healthy cells and tissue. While receiving immunotherapy, it is important to monitor your condition and report all new symptoms to your healthcare personnel. The immune-mediated adverse events can be treated, and the faster they are addressed, the better they are managed. The adverse events occurring during the treatment are usually mild and reversible. However, if their treatment is delayed, the adverse events may become harmful, even fatal. Extensive research is being done to harness the immune system to attack cancer cells. In addition to the immune checkpoint inhibitors, several other types of immunotherapy are under development, showing promising results in early research. If the issues mentioned in this video raise some questions concerning your own cancer treatment, please contact your healthcare professionals to discuss your thoughts or concerns. The Association of Cancer Patients in Finland. Information and support for cancer patients and those close to them.